Good afternoon, everyone. My name is Alex. I'm one of the London advisor for travel medicine for the Royal College. So I have been working in travel medicine for the past 15 years, and I'm the head of travel medicine and immunization service of ACUS and ACUFIL surgery in Northwest London. So just give you a bit of background. I was the program chair for the first pharmacist travel medicine conference at UCL back in 2018, and also the conference chair between the RPS and the Royal College of Physicians and Surgeons of Glasgow Travel Medicine Conference back in 2019. And I serve as a London advisor for travel medicine since 2019, and I'm the module lead for Module 7 for postgraduate diploma for travel medicine. I'm also the examiner for the postgraduate diploma of travel medicine, and currently also just have an additional role as the Hong Kong advisor for travel medicine. Professionally, in other regions, I'm a lecturer for the Chinese University of Hong Kong, and also I'm the president of Hong Kong Immunization Society of Immunization and Travel Medicine, HKSITM. So to date, I have educated 4,000 pharmacists in travel medicine through PGD accreditation and 12,000 vaccinator and advanced immunization techniques in the world. Through the network for Hong Kong Society of Immunization and Travel Medicine, I'm a strong advocate for public health program for implementing travel health consultation and risk assessment for every travelers in Hong Kong healthcare system. So today, I just want to give you a overview of how to set up a specialist travel clinic through CQC and the GPXC route. This is intended as a guide, but at the same time, if you want more further information, feel free to email myself. I'm happy to support you. So first of all, I would like to start with the pharmacy side. This is the pharmacy route, DSP of private pharmacy. So there is two options for you to set up a pharmacy. The reason why we set up the pharmacy, we can supply medications rather than just administer medication. There's two options. One is DSP, one is private pharmacy. DSP is providing remote consultation. However, under current legislation, you can provide face-to-face consultation as well. This provides flexibility, patient engagement. And the requirement is you need to have a compliance website with the GPXC. If you provide this route. At the same time, private pharmacy, if you prefer to more face-to-face consultation, but at the same time, this is where it's confusing. You can still provide remote consultation if needed under current regulation. But simpler way is distance selling pharmacy, usually remote consultation, private pharmacy, usually face-to-face consultation. And under this current CQC license requirement, because for the GPXC is more for the pharmacist travel clinic. For the doctors, nurses, dentists to run a travel clinic, you need to obtain a CQC license. For the but when you set up a pharmacy travel clinic, you need to appoint a superintendent because that is like an overall hierarchy for the clinical governance, as well as you need to appoint a responsible pharmacist to oversee the supply of medications on day-to-day basis. And the role of superintendent and responsible pharmacist can be the same person or different. I would like to talk a bit about the off-license medication supply because that is going into a bit more technical. So let me just go through the route for the CQC registration. So if you are non-pharmacist, you need to set up CQC license. First of all, you go through Regulation 15. It's about space and also hygiene, cleanliness, infection control, storage requirement. And then you need to go through health and safety compliance, cost, and also fire safety, electrical safety. And then you need to go through infection control measure. This is the NHS cleaning standard document in 2021. And then you also have the handling or storage of hazard substance under cost regulations. To be honest, there's quite a lot of inspection requirement which you need to prepare before the inspection. And then you have the governance policies, health and safety policy tailored under clinical risk. And then you have incident reporting and then emergency procedures. We can share the presentation if you need it to look through the details. And then in terms of staff training and management under Regulation 7 you need to have a registered manager under CQC and also adequate staff training, fit and proper person requirement for Regulation 5. All the directors of this company, which is for this CQC premises, must be passed the DBS check and also other qualification check. And in terms of medicine and vaccines administration and storage, Regulation 12 about safe care and treatment, medicine must be stored securely at correct temperature. Vaccines fridged must be validated. So all those requirements and costs as well for disinfectant, sharp bins, and cleaning agent. And then you have patient safety and experience. So duty of care, Regulation 20, openness with patients. It's about compliance. It's about complaint procedures. It's about how to capture feedback. So those are under that. And also you need to display your CQC rating on the premises on the website under Regulation 20A. So a lot of information, but I just summarized that in the roadmap. So first of all, you need to check for your premises whether it's suitable for as a CQC premises. That could be also about the classification of the buildings as well, the licensing. And then you have the governance package. So about policy, course, safeguarding, health and safety, fire safety, incident reporting, and also staffing. You must be appointed a registered manager for overall responsibility on governance. And then you have the medicine management for vaccines, fridge, SOPs, PGD, and prescribing. So this is about the clinical procedures. And then you can apply the CQC classification under treatment of disease or disorder of injuries. And then you have the inspection ready. Usually what we do is we normally have a checklist for us, and then we have multiple mock inspection just to make sure we are compliant, or any unexpected questions will be raised by the CQC inspector. We need to be ready for that as well. Okay, I have mentioned about the off-license prescribing. Because Diamox is a sozolamide, is commonly used to prevent or reduce symptoms of altitude sickness by accelerating the acclimatizations for the body to high altitude. The license indication for this treatment for Diamox is for glaucoma. For AMS, is considered as off-license. When we're prescribing Diamox for a travel clinic, it is essential to ensure that your professional indemnity to cover for this off-license prescribing, because if something happened, because this is not as intent product license indications, is under more like an expert opinion or expert treatment. So that will be directly under the prescriber. And also the prescriber must have the correct qualifications for this type of prescribing, such as our Royal College for Physician Surgeon Glasgow postgraduate diploma for travel medicine, and also for the International Postgraduate Diploma of Expedition and Wilderness Medicine as well. So you can join us for the education side. Okay, it's just a very quick case for the because obviously pharmacists, nurses, doctors are traditionally running travel clinic, but for dentists, this is gone through a journey. I'm proud to say that I have supported one of the first dentists to become a travel clinic back in 2017, or actually 18, and then just before COVID, he has successfully set up his her travel clinic. However, she faced severe scrutiny by the NAFNAC because she wanted to set up a yellow fever center. And what happened is, at the time, NAFNAC do not agree that a dentist should able to provide a yellow fever center vaccination. So we actually help her step by step how to overcome those problems. It takes a while. It's not actually quite straightforward. I just share with you what happened. So first off, some legal basis. So under Medicine Act 1968 and also Human Medicine Regulation 2012, dentists are appropriate practitioner and can issue NHS private prescription. They are, but also NHS side limit to dental practitioner formulary, but the private prescribing side, dentists may prescribe, including vaccination under the patient best interest and within the professional competencies. This is where a bit tricky. GTC standard, dentists must prescribe only within their competencies. Prescribing outside the usual dental scope require evidence of appropriate training, indemnity, and competency. So basically what we did is we provide necessary training for the dentist. We provide PGD for the dentist because direct prescribing at that time is a bit gray area. but now I think it's a bit more clearer. But still, I think if you are a dentist, you want to set up your travel clinic, I suggest you clarify with your insurance provider and also your GDC regulator for direct support. But obviously, there is a lot of governance process like coaching management, anaphylaxis management, professional indemnity. I know there's 2 major insurance providers for dentists, and also CQC registration is required because the dentist cannot directly work in the GPXC premises. So if a dentist want to provide medication like anti-malarial, basically you need to set a pharmacy. At the same time, the pharmacy need to employ a superintendent pharmacist, and the superintendent pharmacist could be the RP responsible pharmacist as well. They could be the same person or different person, which we have highlighted before. Dentists can legally issue private prescriptions for travel vaccination, provided they have the relevant training and within the scope of practice. So this is a gray area which requires further evidence to prove that you are competent. So yellow fever vaccination is a special consideration because on top of the regulation for Medicine Act, you also have an additional qualification for the pharmacy or the CQC premises to become a yellow fever center. This is for the center. On top of that, you need to make sure the practitioner, which is the dentist, can also yellow fever center trained. So one of my students who was a dentist received the NAFNET training back in 2019. And then it was a face-to-face training at that time. Now everything is like a virtual face-to-face classroom training. So that was back in the old days that you can still go to ECH to receive your face-to-face training if you're from London side. And yellow fever vaccines, just recap, is a POM. But at the same time, because of the World Health Organization special international law for governing yellow fever vaccinations certification system, this requires additional training and additional licensing for the premises. So, take-home message. I want to make sure all of us, when we set up a specialist travel clinic, first of all, if you're a pharmacist, you can set up as a travel clinic under the pharmacy side, under DSP or private pharmacy. It is still a bit confusing. So what is the difference between DSP and private pharmacy? But at the moment, I think they could be classified at a similar sense. But obviously, when we cannot assume that regulation cannot be changed in the future. But in terms of the non-pharmacists, which is doctors, nurses, and also for dentists, you need to have your CQC registration sorted first. And if you want to supply medication either remotely or in face-to-face sense, you must set up a private pharmacy or DSP to enable that supply. So that is my key message for everyone. If you have any questions, feel free to ask me directly. Thank you.